Have you ever heard of a penile implant? Well, I'm Dr. Rena, a urologist and pelvic surgeon, and today I'm going to explain the 3 different types of penile implants available for men who struggle with erectile dysfunction. Alright, as I mentioned, penile implants can be an option for men with erectile dysfunction who don't get results from other treatments. These treatments include medications, injections, or devices such as a vacuum erection device. You can learn more about those options in one of my earlier videos, where I discuss the different treatments available for erectile dysfunction. Before we talk about the different types of penile implants, it's important to understand that this is usually considered a last-line treatment for erectile dysfunction. Once this procedure is done, you can't return to having natural erections. Because of that, it's generally recommended for men who have tried other methods and still cannot achieve a natural erection on their own. Now, sometimes the idea of getting a penile implant may sound very appealing because it can make life easier, but it's still different from having your body's natural erection. Even so, there are several advantages. The most obvious benefit is that you can create an erection whenever you want. For many men, this leads to better sexual satisfaction overall. Another advantage is that these implants are designed to last a long time, often 10 to 15 years or even longer. They also require less ongoing effort compared to taking a pill regularly or using injections every time you want an erection. Many men who receive penile implants report being very satisfied with their decision, and they often recommend the procedure to others. Interestingly, their partners also tend to feel satisfied with the results. While there isn't a huge amount of research specifically focused on partner satisfaction, studies generally show that partners of men with penile implants are happy with the outcome. So how does the procedure actually work? To place a penile implant, a surgical procedure is required. During the surgery, the doctor makes a small incision either between the penis and the scrotum or just above the penis in an area called the infrapubic region. Through that opening, the implant is carefully inserted into the penis. As I mentioned earlier, there are currently 3 different types of implants, although in the future there will likely be only 2. I'm sharing all 3 because, at this moment, these options still exist. The first type is called a semi-rigid implant. This implant is made of 2 flexible rods. These rods stay somewhat firm most of the time. When you want an erection, you simply bend the penis upward, and when you don't want it, you bend it downward. One advantage of this type of implant is that it's very simple to use. It's especially helpful for men who may have limited hand strength or dexterity. Another benefit is that the risk of malfunction is extremely low because it's basically just 2 rods. There are no pumps, no moving fluids, and no mechanical parts that could fail. However, the main drawback is that the penis never truly becomes soft or fully deflated. That means you don't get that completely natural flaccid feeling. Another thing to understand is that the penis stays somewhat semi-erect most of the time, which can place more pressure on the surrounding tissues. Because the implant keeps a cylindrical shape and remains partly firm, it creates continuous pressure in the area. This can slightly increase the risk of the implant slowly wearing through or eroding into the surrounding tissue. Thankfully, this is uncommon, but it is something doctors keep in mind. You can also notice that the device has small measurement markings along it. These markings help shape the implant properly. During surgery, the surgeon measures the penis and adjusts the implant to the correct length so it fits your body. Once the correct size is determined, the rods can be trimmed if needed. Since there are 2 rods, they are placed side by side inside the penis during the procedure. Now let's move on to the 2-piece inflatable implant. This particular implant may only be available for a limited time because manufacturers are expected to stop producing new 2-piece models in the future. The system includes 2 fluid-filled cylinders that are placed inside the erectile tissue, along with a small pump that sits in the scrotum. When you press the pump in the scrotum, fluid moves from the pump into the cylinders, creating a firmer erection. However, the pump itself is fairly small, which means it cannot move a large amount of fluid. Because of that, the implant never becomes completely soft. There will usually be a small amount of fluid left in the cylinders, so the penis may stay slightly firm. That said, it still becomes firmer than the semi-rigid implant, which many patients prefer. This option can be a good fit for certain men. One reason is that the pump is relatively simple to operate. Usually, it only takes 2 or 3 squeezes to inflate it. For someone who has limited hand strength but doesn't want a semi-rigid implant, this can be a comfortable middle ground choice. It may also be helpful for men who have previously had abdominal surgery and prefer not to place an additional component in the abdomen. Since the two-piece system doesn't require a separate fluid reservoir in the abdomen, it can sometimes be the safer option. If you look at the device, you can see the 2 cylinders and the small pump. The pump sits in the scrotum, while the cylinders are placed inside the erectile tissue. The length can be adjusted by adding extensions to the back end, and the implants come in different sizes to match the patient's anatomy. To use it, you simply squeeze the pump and the cylinders fill with fluid, making the penis firmer. When you're finished, you bend the penis gently to release some of the fluid and partially deflate it. You can see it soften slightly compared to when it was fully inflated. Again, when you pump it, it becomes firmer, and when you bend it, it releases pressure and softens. Now let's talk about the 3-piece pump system. The 3-piece implant is currently the most commonly used option and is designed to feel and look the most natural. Similar to the previous system, it includes fluid-filled cylinders that are placed in the erectile tissue. But this design also includes 2 additional components: a pump placed in the scrotum and a fluid reservoir that is positioned in the lower abdomen. The reservoir stores fluid. When you want an erection, you squeeze the pump located in the scrotum. This moves fluid from the reservoir into the cylinders, making the penis firm. When you are finished, you press a release button on the pump, which allows the implant to deflate and sends the fluid back into the reservoir. Here you can see the Coloplast model. It includes the same cylinders, which are connected to a fluid reservoir that sits in the lower part of the abdomen. There is also a pump placed in the scrotum. To create an erection, you simply squeeze the pump located in the scrotum. It usually takes more pumps than the 2-piece system, typically around 10 to 15 squeezes. Once pumped, the cylinders become fully inflated and firm. When you want to deflate the implant, you press the small release button at the top of the pump. Then, by gently squeezing, the fluid moves back through the tubing and returns to the reservoir. As you can see while pressing and squeezing, the fluid goes back into the reservoir and the cylinders gradually soften. This here is the Boston Scientific version. In this example, the reservoir piece isn't attached, but normally it looks quite similar to the other one. Just like the previous system, it has 2 cylinders connected to a pump. The bottom line is that any of these implants can produce an erection firm enough for penetrative intercourse. The main factors to consider are whether you have the hand strength and coordination to operate a pump, and which pump design feels most comfortable for you. The pumps are slightly different in how they work and how they feel in your hand. So when you visit a urologist, it's helpful to actually see and handle them. For example, this is the Boston Scientific pump, and this is the Coloplast pump. The 2-piece system also has its own pump style, which works a bit differently. Another important thing to understand before choosing surgery is what to expect regarding penile length. A penile implant will not make the penis longer. The best way to estimate your length after surgery is to gently stretch the penis and measure it when it's fully stretched. That length is usually very close to what your erection will be with the implant. In some cases, it may even appear slightly shorter. One reason is that the head of the penis, called the glans penis, does not inflate the same way it did before. It may not become as firm as the rest of the shaft because the implant only fills the internal erectile chambers. As long as you understand that and feel comfortable with it, you can move forward with the procedure. And remember, as mentioned earlier, this is considered a last-line treatment. Once the implant surgery is performed, you cannot go back to using medications or other treatments for erectile dysfunction because those methods will no longer be effective after the implant is placed. During the procedure, the device is positioned inside the erectile tissue of the penis. Even so, it provides a very reliable and consistent way to achieve an erection whenever you want. You will still be able to experience normal orgasms, ejaculation, and sensation, just like before the surgery. Now let's talk about the potential risks. The most significant risk associated with penile implant surgery is infection. Fortunately, infection rates are quite low. Studies generally estimate the risk somewhere between 1% and 10%, depending on whether it is a first-time surgery or a revision procedure. If you have conditions like diabetes, if you smoke, or if you take medications that weaken your immune system, your risk of infection will be higher. Because of that, it's very important to understand these risks and do everything possible to lower the chance of infection before surgery. The reason this matters so much is that if an infection occurs after this procedure, whether the risk is 1% or 5%, it becomes your personal situation. And when an infection develops, the implant usually has to be removed. In some cases, it can be replaced right away, but sometimes it must be completely taken out. That decision depends on what the surgeon sees during treatment and how severe the infection is. If the implant has to be removed, there is unfortunately no easy way to reverse the situation. The tissue in that area may develop additional scarring because surgery has already been performed there. Over time, this can also lead to some shortening of the penis. Because of this, preventing infection is one of the most important parts of penile implant surgery. A great deal of research has been done to reduce this risk. Surgeons who perform penile implant procedures spend a lot of time making sure the operating room is prepared correctly, that proper antibiotic solutions are used, and that strict sterile techniques are followed. All of these steps are meant to protect patients from infection. Another important point involves medications that thin your blood, sometimes called anticoagulant therapy. If you are taking these medications, you may need to stop them before surgery, sometimes up to a week in advance. Always speak with your surgeon and make sure they know every medication you take, including vitamins and supplements. There are also other potential risks. These include injury to nearby structures, such as the urethra, infection as mentioned earlier, or problems with the implant itself. Since this is a mechanical device, it can occasionally stop working properly. Another rare complication is something called erosion, where the implant slowly pushes through the skin. Although this is uncommon, occurring in less than about 3% of cases, it is a serious problem that requires immediate surgery. The semi-rigid implant rarely has mechanical failure because it doesn't contain moving parts. It can often remain in place for many years. The inflatable implants, however, usually last around 10 to 15 years. According to available data, about 85% of implants are still functioning well after 10 years, and around 75% are still working properly after 15 years. Now let's talk about what happens after surgery. Recovery is extremely important. After the procedure, you must avoid sexual activity for at least 4 to 6 weeks. Of course, you should always follow the specific instructions given by your surgeon. You should also avoid heavy lifting or strenuous exercise during the early recovery period. In my own practice, I usually see patients about 3 weeks after surgery to check that the incision is healing properly and to make sure there are no signs of infection. Around 3 to 4 weeks after surgery, patients can usually begin cycling the implant. This simply means gently inflating and deflating it. Doing this helps the device settle comfortably within the tissues and ensures everything is functioning correctly. So the bottom line is this. Penile implant surgery can be an excellent option for men dealing with erectile dysfunction, especially when other treatments have not worked. There are 3 main types of implants: a semi-rigid implant, a 2-piece inflatable implant, and a 3-piece inflatable implant. Each one has its own advantages, and the right choice depends on your individual needs. Like any surgery, implant procedures do carry risks. That's why it's very important to fully understand those risks and discuss any questions or concerns with your doctor before making a decision. And as always, remember to take good care of yourself, because your health truly matters.